Hello everyone, this is Dr. Durst with RevitalyzeMD. So today we're going to talk a little bit about vaginal laser rejuvenation. So how do we get to the point where we're even thinking about vaginal rejuvenation with lasers or anything else? And we get there because, again, we notice some changes with aging. And so what do women notice with aging? And what do I find is very common if I sit a room full of women together and we talk about things we might be experiencing as we age? So they'll complain of brain fog, low energy, low sex drive, and frequently no sex drive. Your body composition changes or weight changes. So again, I'm doing the same thing I've always done, eating the same, exercising the same, and I just keep gaining weight. Around the middle, common areas, the thigh, we're changing body composition and we're noticing that. Behind the arms, bra fat, women will complain about similar things. So I'm sure if you're listening to this, you can identify with some of it. And again, we may complain of hot flashes, but we're not really going to complain about a couple of things that are happening. So what are those few things that are happening? Again, vaginal dryness. That's something that frequently we're not going to talk to family or friends about. We will bring it up with the doctor, but there's only very limited resources and solutions that are offered. And so vaginal dryness leads to vaginal pain with sex. And again, that's something we really can't hide. So decreased orgasmic strength is something we notice over time, and that can be changes with life or changes with decreased hormones. And that isn't as obvious. So we can kind of hide that, maybe not have a discussion. And frequently we don't want to have that discussion with a partner because we'll make them insecure. And sometimes they're not open to that. They think it's them, when in fact it's just changes we're noticing as we age. And so that pain, that dryness, decreased orgasmic strength are things we're not going to talk about. Vaginal laxity with childbirth or just hormonal decline or aging is something that is noticeable. And so we may end up talking about that. And if we've had children vaginally, then we might complain of urinary incontinence as well. So those are some things that you're complaining or at least noticing, and you want to see some solutions. So you end up on Google looking for solutions, right? Or you're going to bring that up with your regular doctor or your GYN doctor. So when we talk about solutions that don't involve surgery or medications, we're talking about vaginal rejuvenation. And really what we're talking about is hormone optimization and sexual rejuvenation. So we'll look if we're perimenopause or menopause or we're of an age where we're noticing those other things, brain fog, energy, low libido. Those are in body composition changes, weight changes. Those are more a hormone issue. And so, we frequently are looking at hormone levels, optimizing, but then when we're talking about changes locally, dryness, pain, decreased orgasmic strength, which is huge with women as we get older, then we're talking about hormone optimization, but also vaginal or sexual optimization. Or we can look at that as sexual rejuvenation. So what does that entail? Frequently an ohsot and some lasers that are going to rejuvenate. And we frequently are pairing those together. We have other videos that I would encourage you to watch and other pages on the website for the ohsot. But the ohsot in simplicity is we're drawing PRP, which is platelet-rich plasma. Platelets have growth factors, and we're re-injecting them into tissues to get, again, increased in blood flow, which is going to increase lubrication and going to increase arousal. We have increase in nerve fibers and sensitivity with an ohsot, and that means increased orgasmic strength, increased arousal. So if you have increased blood flow, you're going to have decrease in dryness and decrease in pain, and so it also helps with urinary incontinence. But the bottom line is it's going to work best if you're pairing it with laser that rejuvenates. So what are we talking about when we're talking about vaginal rejuvenation with lasers? And really what we're talking about there are different types of lasers, different types of names. What we want to do is heat or tell the tissue it's injured to get rejuvenation. And so if we look at the tissue with it, basically we're looking at the vaginal canal and we want to rejuvenate it. So here's a picture of the vaginal canal. With our lasers, we're talking about, we have two different lasers that do vaginal rejuvenation, and either one of those are going to ablate tissue. Ablate tissue means you're taking a layer off and when you're actually creating that injury. And I like a non-ablative form where it doesn't do that. So one of ours is called Votiva, and Forma V or Votiva is what you'll hear it referred to. You're using a probe, and here's a picture of the probe that's going throughout the vaginal canal. And so it's basically going to go into the vaginal canal. We're going to come out. We're going to also rotate the tip, which has the radio frequency, into it. That's heating the vaginal canal, telling it it's injured, and then stimulating collagen and elastin. And it's also going to stimulate blood flow, and it's going to stimulate nerve sensitivity and regrowth. And so you're going to get increased orgasmic strength. You're going to get increased sensation, lubrication, and tightness. So you'll start to feel some tightness with this procedure, which is awesome. And you actually feel it with the first one. We usually recommend a series of 3. We always recommend a series of 3, because the only time I'm not recommending a laser vaginal rejuvenation is when somebody hasn't had children before, they're younger, and they don't have any laxity. Then if they're having dryness or decreased orgasmic strength, we're really gonna maybe then recommend an ohsot alone. Otherwise, we're always doing it in a pairing of the vaginal rejuvenation with the lasers and with the ohsot, because you're gonna get an increase in orgasmic strength that is life-changing. You're gonna have improvement in urinary incontinence. You're gonna have lubrication that's improved. And again, these are life-changing. You no longer have pain, you have lubrication, you don't have painful sex, you have orgasms with sex. So a series of 3, and usually we'll pair that with the ohsot. So again, if you're having any issues with vaginal dryness, vaginal pain, decreased orgasmic strength, laxity, or urinary incontinence, then these procedures you're going to want to consider. We have Votiva. We also have another laser that does it. So depending on what you want to see, if you have some basically maybe tightening on the outside, or maybe there's pigment, then we'll vary our treatments based on that. There's lots of factors that go into it, including hormone optimization, if that's right for you. And so we want to thoroughly evaluate you from a medical standpoint, decide what procedures are right for you, and how to maximize the results you're going to get to have life-changing solutions to all of those problems that you may be experiencing, such as, again, urinary incontinence, vaginal dryness, vaginal pain, laxity, and therefore, decreased enjoyment with sex. So please give our office a call. You can call, you can text the business line, or you can submit a form online, and we'll get back to you as soon as possible. Let's get you into the office, and I look forward to seeing you. Thank you.